Hi, my name is Baylee. I'm a student pharmacist, and this is Cassie. She's also a student pharmacist. We just want to take a second to talk to you a little bit about your injury and help you understand it and the purpose of the medication that we are recommending for you. It's going to take about 6 to 8 minutes. Is that okay if we do this counseling session?
Yep, that's fine.
And just to clarify, you are looking for something to kind of self-treat this before seeing your doctor.
Right.
Okay, so let's go ahead and move to a private environment. How about that?
Okay. All right. And Haley, what symptoms are you having right now?
So I have some pain in my lower back area, and I notice if I tend to move around a lot or use it often, it'll swell a little bit.
Okay. And are those the only characteristics that you're really having, or like moving or swelling?
Yeah, just the movement and long-term use causes some swelling.
Okay. Do you have a history of this? Has this kind of back pain happened before?
No, it just started happening recently when I exercise, and I do that about 3 times a week.
Okay. How long have you been experiencing this pain?
Just 2 days.
Okay. And what is the location of the pain?
My lower back.
All right. And what are the factors that aggravate the pain? Like what makes it worse?
Really just moving, sometimes walking around a lot, just overall movement and using it more than I should be.
Is there anything that makes it feel better?
I've been doing some ice and heat back and forth, and that helps a little bit.
Okay. And what kind of medications are you on at home? Anything prescription, non-prescription, botanical?
I'm on PHAR for my anxiety and Allegra for some seasonal allergies.
Okay. Do you have any allergies to medications or allergies to anything really?
Not to medication, no, but I do have, seasonal allergies.
And what are your seasonal allergies? What do they act up to?
Like pollen, stuff like that.
Okay. And do you have any chronic health conditions, any heart problems or seizures or anything?
Nope.
All right.
Okay, Haley. So what we're going to recommend for you is ibuprofen or Advil. Have you ever taken this before?
Yeah, I have.
Okay, so what this is going to do, it's an anti-inflammatory. It's just going to kind of help with that pain and swelling. It is a non-steroidal anti-inflammatory. It's going to inhibit the enzymes that make the pain or the inflammation. So what we're going to do is they come in 200 milligram tablets. We're going to do one of those every 4 hours, just as needed for the pain. And don't go over 6 tablets within a 24-hour period. You're going to take this orally. Some of the common effects are like nausea, vomiting, gas, bleeding, maybe dizziness or a headache. Rare but serious side effects are going to be change in vision, shortness of breath, swelling, a rash, and then some of the biggest warnings and precaution would be signs of bleeding, liver problems, low red blood cells, kidney problems, heart attack, stroke. Those are very rare, like I said, but if you feel any of those or have any concerns, feel free to reach out to your physician with that issue. There aren't many interactions. It's a pretty safe medication. It'll be good with your BooSpar and your Allegra. But if you normally take aspirin or are thinking about taking aspirin, you're going to want to not do that. It can kind of just nullify the effects. It'd just be kind of useless. And then try to stay away from alcohol because that can cause more bleeding. The same with the Advil. They kind of do the same thing. And then other NSAIDs. So if you do see your physician, let them know that you are taking ibuprofen. And if they put you on something like naproxen, you're going to want to stop that. Okay. So like I said, if you have any of those adverse effects, warnings, go ahead and take action, reach out to your doctor. If you miss a dose, it's really not that big of a deal. Ibuprofen, we're just going to be using this as needed. So if you realize you've missed a dose and you're kind of feeling that pain again, go ahead and take it. Don't double up. That is perfectly fine. As for storage, keep it at room temperature, away from any kids and pets. Try to keep track of the pain, see if the ibuprofen is helping, and also how long this pain is persisting. So like if it goes over a week, you're going to want to see your physician. Or if the ibuprofen doesn't really help, you might want to contact them as well. As for the ice and the heat, we want to keep doing that in addition to the ibuprofen, especially because you said that was helping you. If if it is helpful or you have any other questions, we want to see you in the next couple of days. And again, if it hasn't improved within a week, go see your physician.
Okay.
So can you repeat that back to me?
Well, that was a lot of information, but the basics, you're giving me ibuprofen, and I'm supposed to take 200 milligrams every 4 hours when I'm feeling pain. And I'm not supposed to take more than 6 in 24 hours. There's some side effects with it. And if I experience anything that's not normal, I should see my physician. If it lasts more than 1 week, the pain, I should go to my doctor as well. Continue to do my ice and my heat to help, and store it in a dry place, not in the bathroom and away from children. Yeah, I think I got all the basics down.
Okay, and just remember not to double up on any doses. We want to keep you as safe as possible during this. That sounds really good. Do you have any other questions?
Not as of now, no.
Okay, we'll see you back here in a few days.
All right, thank you.
Thank you.